Hi, my name is Miriam Nabolsi. I am the Chronic Disease and Medication Management Program Coordinator here at Alliance Health, and today we're going to be talking about nutrition recommendations in patients with chronic kidney disease, or CKD. For today, our objectives are to define chronic kidney disease and the impact of the kidneys just not functioning as well, understand how nutrition choices impact our health with CKD, review alternative food options and substitutes that we might recommend to our patients with CKD, and then determine what are the appropriate portion sizes after lab results indicate that there has been a decline in kidney function. And lastly, assess when patients should be referred out to a dietitian for MNT or medical nutrition therapy. When you are working with a patient with CKD, they should have a checklist at the end of their visit of things that you've gone over with them. The first, they should have an understanding of how the kidneys work and the slow decrease in kidney function with CKD, so what that means and how that impacts them. They should be able to choose foods that are healthy for their heart and their kidneys. They should avoid foods that are high in sodium, potassium, and phosphorus. They should understand what portions of calories, fats, and proteins, as well as fluids, are recommended for them. And then they should also learn and read and interpret different lab reports that we present or their doctor presents to them. So kidneys and chronic kidney disease. So what the heck do the kidneys do? The kidneys remove waste and extra water from the blood to help make urine. So they help keep the body working properly. The kidneys balance the salts and minerals such as calcium, phosphorus, sodium, and potassium that circulate in the blood. The kidneys also release hormones that help make our red blood cells. So this might indicate why patients become anemic if they have chronic kidney disease. It also helps regulate blood pressure and keep our bones strong. So if you look at the picture on the right, there's a smaller picture of a kidney, and then zoomed in on the kidney there's a nephron, and then within the nephron there's a kidney tubule, where that'll show you the kidney's actions and how it helps regulate those salts, minerals, and fluids. CKD usually takes a long time to develop and does not go away. So in CKD, the kidneys continue to work just not as well as they should. So waste may build up gradually, that the body becomes used to having those wastes in the blood. So salts containing phosphorus and potassium may rise to unsafe levels, which can cause heart and bone issues. Like I mentioned before, anemia may result after low red blood cell counts because the kidneys stop making the hormone erythropoietin. And after months or years, CKD may progress to permanent kidney failure, which requires the person to either have a kidney transplant or go to kidney filtering treatments or blood filtering treatments called dialysis. The kidneys also we already mentioned a lot of that. So in CKD, the risk factors for developing chronic kidney disease include diabetes, high blood pressure, a family history of kidney failure, cardiovascular disease, patients with a recurrent UTI, patients who have HIV infection or other immunological diseases. Protein. So let's talk a little bit about protein. It's an essential part of our diet. It helps us build and maintain muscle, bones, skin, connective tissue, internal organs, and blood. So they help fight disease and heal wounds, but proteins also break down into waste products that might be removed from the blood by the kidneys. So the more protein that you eat, the body needs may put an extra burden on the kidneys and cause kidney function to decline faster. So sometimes patients will be recommended by their provider to eat moderate or reduced amounts of proteins if they have chronic kidney disease. However, this is kind of a balance that needs to be considered, seeing as if you restrict your protein too much, that can lead to malnutrition. So people with CKD just need to be very careful. Generally, though, the American diet contains more than enough protein, so just learning about portion sizes can help people limit their protein intake without endangering their health. So really keeping your portion sizes to about 3 ounces of protein per meal. The higher protein foods like ground beef, halibut, shrimp, salmon, tuna, chicken breast, roasted chicken should be avoided, and maybe lower protein alternatives can be substituted like chili con carne, beef stew, egg substitutes, tofu, or even imitation crab meat. So again, moderate to reduced portions are recommended. About 3 ounce size or a deck of cards is the general serving size for patients, which equals out to 0.8 or 1 gram of protein per kilogram per day on average. This is generally what's required for these patients. Some food adjustments you might give to patients would be using thinner slices of meat on sandwiches and adding more garnishes like tomatoes, lettuce, onions, other things that might help fill that sandwich. When a patient, though, however, is on dialysis, the dialysis removes a large amount of protein, so more protein is actually required for those groups of patients. Fat. So fat provides energy to produce hormones that regulate our blood pressure and other heart functions. Everyone should know about fat sources because eating the wrong kinds of fat and too much fat increases the risk of clogged blood vessels and heart problems. Everyone needs dietary fat, but some fats are healthier than others. So people with CKD are at higher risk of having a heart attack or a stroke. Therefore, people with CKD should be especially careful about how dietary fat affects their heart health. Oftentimes, if they're advanced, we would recommend that they go to a dietitian, but saturated fats and trans fatty acids can raise their blood cholesterol levels and clog their blood vessels. Saturated fats are often found in animal products such as red meat, poultry, whole milk, and butter. These fats are usually solid at room temperature. Trans fatty acids are often found in commercially baked goods such as cookies and cakes, and in fried foods like donuts and french fries. Vegetable oils such as corn or sunflower oil are healthier than animal fats such as butter or lard. And then there's hydrogenated vegetable oils, which should be avoided because they're high in those trans fatty acids. What we recommend for patients is those monounsaturated fats like corn oil, safflower oil, olive oil, peanut oil, and canola oil. These are the healthier alternatives. In general, patients with CKD should avoid fats that are solid at room temperature, and the general recommended amount of fat is about 5 teaspoons per day. Sodium. So too much sodium in a person's diet can be harmful because it causes blood to hold fluid. People with CKD need to be careful not to let too much fluid build up in their bodies. The extra fluid raises blood pressure and puts a strain on the heart and kidneys. So a dietitian can help find some ways to reduce the amount of sodium in their diet. Nutrition labels provide information on sodium content, and the U.S. Food and Drug Administration generally recommends that patients stick to no more than 2,300 milligrams per day, but patients who are at high risk for heart attack or stroke may be even recommended to go even lower, as much as 1,500 milligrams daily. choosing sodium-free or low-sodium food products will help them reach this goal. So sodium is found in ordinary table salt and many salty seasonings such as soy sauce and teriyaki sauce. Canned foods oftentimes just tell the patient to rinse their canned foods before eating them, as a lot of the preservatives will contain high salt. Some frozen foods and most processed meats have large amounts of salt in them. Snack foods such as chips and crackers are also high in salt. So what do we recommend as an alternative? We have lemon juice, salt-free seasoning mixes, hot pepper sauce. All these things can help reduce a patient's salt intake. People with advanced CKD should avoid salt substitutes that use potassium because CKD limits the body's ability to eliminate potassium for the blood. So, if you're looking at this table, there's a list on the left of high sodium foods and some low sodium alternatives on the right that we should be recommending to our patients. So potassium. Keeping the proper level of potassium in the blood is essential. So potassium keeps the heart beating regularly and muscles working right. So problems can occur when the blood potassium levels are either too low or too high. Damaged kidneys allow potassium to build up in the blood, causing serious heart problems. Potassium is found in many fruits and vegetables such as bananas, potatoes, avocados, and melons, but people with advanced CKD may need to avoid some of these fruits and vegetables. Blood tests can indicate when potassium levels have climbed above normal range, but again, a dietitian may help the patient with advanced CKD find ways to limit the amount of potassium. The potassium content of potatoes and other vegetables can actually be reduced by boiling them in water and instead of preparing them in other ways. So before preparing them, boil them in water, and that will help reduce the amount of potassium. The recommendation is that they have about 200 milligrams or less per serving. And on a side note, potassium content can change, like I said before, if it's boiled. Phosphorus and calcium. So damaged kidneys allow phosphorus and calcium minerals found in many foods to build up in the blood. Too much phosphorus in the blood then pulls calcium from the bones, making the bones weak and a lot more likely to break. Too much phosphorus may also make the skin itch, so foods such as milk and cheese, dried beans, colas, canned iced teas, and lemonade, nuts, peanut butter, all these things are high in phosphorus. As the kidney function declines, you might also notice that patients start to take a phosphate binder, such as Renegal or Phosrenal or Foslo or even Tums, to help control the phosphorus in their blood. Basically, these medications act like sponges to help absorb the phosphorus while it's in the stomach. But because it's bound, the phosphorus does not get into the blood. Instead, it is removed in the patient's digestive system, so it moves through their bowels. If you look on the left of the table, those are some examples of some high phosphorus foods and some low phosphorus alternatives. Continuing on, meat, poultry, and fish, the portion should be about 2 to 3 ounces, or about the size of the deck of cards, as we discussed before. For dairy, it's good to keep those portions to about 1/2 cup of milk or yogurt or 1 slice of cheese and nothing more than that. Beans and lentils should be about 1/2 cup each, and then nuts should be about 1/4 cup portion. And then here's a good image that helps explain portion sizes to a patient who's not keen on reading food labels. So as CKD progresses, people often lose their appetites because they find that foods do not taste the same. So as a result, they consume fewer calories, which are important for energy, so they may lose too much weight. Renal dietitians can help patients with advanced CKD who are losing too much weight, but they may need to also limit how much they drink because the damaged kidneys can't remove any extra fluids. The fluid will build up in the body and start to strain the heart. So it's important that the patient notifies you or their provider if they start to notice any swelling in their eyes, legs, arms, abdomen. This is a sign that they're carrying extra fluid. To help keep thirst under control, you may recommend having them gargle with ice cold water, sucking on an ice cube, or chewing gum. And then lastly, it's always important that we ask the provider what their fluid restrictions might be. Okay, so how do we define CKD? Patients with an estimated glomerular filtration rate of less than 60 milliliters per minute, or those who have protein in their urine of greater than 30 milligrams. That's defined as chronic kidney disease, and then once a patient is at an estimated glomerular filtration rate of less than 15, then we consider this kidney failure. Serum potassium, if it's above 5 milliequivalents per liter, then we need to start limiting intake. Serum bicarb, if that gets above 28 milliequivalents per liter, then they need to restrict their protein. And then with calcium, if their levels are less than 8.5, then it might be a good idea to discontinue vitamin D at this point in time, because vitamin D helps with calcium absorption. So we want to reduce the amount of calcium that's absorbed into the cell and increase the amount that's in the blood. Phosphorus, if it's above 4.6, then we want to limit protein and foods that have added phos to it. Before these, this slide should indicate red flags to you as a health educator. So before we jump to making any adjustments, it's always important to confirm with the providers. So some treatment considerations: you should instruct patients to treat their hypoglycemia with cranberry juice cocktail, grape or apple juice, glucose tabs, or randomly 10 jelly beans. This will help prevent high potassium in patients. And then as their estimated glomerular filtration rate declines, their renal metabolism of insulin and other oral diabetes medications is reduced. So it could potentially cause hypoglycemia because the medication is more active in their system for a lot longer than it needs to be and starts to build up. So if they are all of a sudden improving with their blood sugar readings, it may be an indication that their chronic kidney disease has progressed. Low protein diets also have been associated with improved insulin sensitivity and fasting serum insulin levels. So lower insulin requirements and blood glucose levels, and it will eventually decrease the endogenous glucose production in the patients with diabetes. And then lastly, vitamins like thiamine and folic acid are the only ones that are recommended. There's really no data out there to support vitamin C, A, E, or K that will eventually actually start to accumulate and may cause more harm than help for the patient. So when do we refer a patient out? MNT, or medical nutrition therapy, is a use of nutrition counseling by a registered dietitian to help promote their medical or health goal. A healthcare provider may refer a patient to a registered dietitian to help the patient's food plan. So many insurance companies cover this, especially Medicare. So one way to locate a qualified dietitian is to contact the Academy of Nutrition and Dietetics, or go to www.eatright.org and click on Find a Registered Dietitian. There you can just enter in their zip and identify what dietitians might be in their area. A person that might be looking for dietary advice to prevent kidney damage should then click on specifically renal or kidney nutrition so that you can get a specialist in this field. Dietitians who specialize in helping patients with CKD are actually called renal dietitians. So recommend that a referral is placed to their provider when the patient is not meeting their goals, or if their labs continue to trend towards kidney failure, or if they are on dialysis. So here is a sample grocery list for patients. If they're looking for low potassium fruits and veggies, refined grains and starches, simple proteins, dairy, and how to flavor without salt. If you're looking for more information on chronic kidney disease and managing patients specifically with diabetes, you can check out these links as well. And that's all I have for you folks.